Okay, hello everyone. My I wanted to just welcome you to the first ever Mentor Mastermind meeting. My name is Dr. Vincent Justino. I'm a chiropractor and member of the OUM Chiropractic and Medical Advisory Board, along with being one of the key team members bringing you the Mentor Mastermind meeting. So today we have with us Dr. Peter Hinz, and he is going to be our first interview. It is a pleasure to interview Dr. Peter Hinz. He has a great practice in Franklin, Tennessee, which is just outside of Nashville, Tennessee, for all of you who don't know that. He's a graduate of Palmer Chiropractic College in Iowa in 2008. He moved to Franklin right after to open up his practice in Cool Springs, which is part of Franklin, in 2009. For the last 6 years, he has been the District 5 Director on the Tennessee Chiropractic Association and sits on the board of OUM for the last 3+ years. He has a passion for helping new docs grow, and over the last 14 years, he has worked with several preceptors and associates, seeing them go on to open and purchase their own growing clinics. Dr. Pete uses the hard-earned battle scars to help the next generation of doctors not repeat his mistakes and grow the profession, which is really what all this is all about. So that's why this is such an exciting thing. And I'm very, very happy to be doing this with you, Dr. Pete.
Well, Vinny, I'm honored to be on. I appreciate you having me.
Excellent. Wonderful. So the purpose of the OUM Mastermind meeting is to provide a link between the doctors of chiropractic, a mentor like yourself and someone who we consider is knocking it out of the park, which you definitely are. And also people right on from the student level all the way up to, old timers like me who are just looking for some fresh ideas and some insight as to what other people in the profession are doing. I mean, sometimes we're so busy doing what we do and helping people, that we fail to communicate with our fellow chiropractors. And, this is about building a link between the two of us and, having someone mentor the profession, people in the profession who need mentoring or just desire to have so. Success leaves clues. So we're looking to get inside your head and see what those clues are so that we can, just see what you're proud of and what you love and, how you've done what you do. So with all of that being said, I'm going to switch over. So what this is going to be, as I've told you, Dr. Pete, this is going to be a series of questions. Okay, so we're going to kind of use them as a guideline, and we're just going to go at it right from there. So we're going to start out with you just telling me a little bit about yourself. So just describe how you practice in terms of your business model. That's key, and the care model of how you treat patients.
Sure. I'm now currently a single doctor. I just let my last associate go because he is off to buy a practice just outside of town. So he is moving on and growing that way, which is good. So single doctor office now with 3 team members. We run a family wellness practice, essentially. Just Palmer Diversified. Obviously, that's in my blood and where it came from. So but a family practice, that's my model. We're now moving and continue to grow into just true wellness and lifestyle, which has been really, really awesome. So transitioning from the mechanistic to the holistic, which is really great.
Can you elaborate on that a little bit?
Yeah. So part of what we do is honestly, it's educating, right? We forget that going through school, you forget you're in school in class with people that are learning just chiropractic for 4 years, and you assume that everybody in the world understands what chiropractic is and what it does and what it's for. And we forget that the layperson, the normal patient that walks in your door says, I have back pain, you fix me. And so our job is to educate them, help them grow and understand what chiropractic can be, right? And what it is to them. So we're getting into the point of just educating and being intentional about educating and making sure that people understand the chiropractic message. And so it's been a lot of fun.